This segment is sponsored by Metropolitan Pediatrics.
It is flu shot season, which is why we are at Metropolitan Pediatrics. It's a brand new location at Bridgeport Village, and I am with Dr. Jenny Malcolm and Dr. Catherine McClellan to talk about the Comfort Promise. What exactly is the Comfort Promise here?
The Comfort Promise is our promise to you that we will do all that we can to minimize any unnecessary distress or discomfort during medical procedures. As you can imagine, this is really especially important when we're talking about needle pokes or blood draws, things that can be distressing and uncomfortable for children and adults sometimes.
And why is comfort at the pediatrician so important for little kids?
By addressing discomfort around needle pokes, we can actually do a lot to impact future health care. For example, we know that about 25% of adults have a fear of needles that really starts from painful medical procedures. And about 10% of adults will go on to not seek medical care, even when it's needed due to fear of needles or medical procedures.
Dr. Malcolm, how does the Comfort Promise disrupt the pain cycle?
Well, we know that when we feel anxious and scared, our body jumps into our fight or flight response where our heart rates go up, we start sweating, we feel really nervous. And initially that's really protective. We actually feel less pain during that. But if that is persistent and we feel that over and over again, our pain is actually amplified, meaning we actually have more pain. So Comfort Promise helps us disrupt that pain by a lot of different techniques.
How does the Comfort Promise apply to infants?
When they are drinking something sweet, whether it's sucrose or breast milk, it actually triggers their internal mechanism for decreasing their pain. Breastfeeding in general is also a great technique. So they're by their moms, we've got that skin-to-skin contact, their positioning is perfect, and then they have that sweet milk and the sucking, all things that actually help decrease pain in infants.
Dr. McClellan, how do you support older kids and teenagers?
We use the thinking, feeling, and doing model. So in terms of the feeling options, what we want to do is alter or disrupt the sensation of pain so that we can diminish the experience. So we have a couple of different things we use for that. One is the shot blocker. We also use the Buzzy Bee. Training children how to do deep breathing to relax their body is also one of the techniques that we do to really help them reduce the discomfort. Playing with putty, other toys, blowing bubbles, all of these things shift your attention away from the poke and can help it go more smoothly. And parents can remind their children that, they've probably had many other uncomfortable experiences that they've made it through quite well. Even scraping your knee or getting a paper cut can actually be more uncomfortable than the poke from an immunization.
Dr. Malcolm and Dr. McClellan, thank you so much.
For more information on Metropolitan Pediatrics, visit them on the web at metropediatrics.com.